The broadcast is now starting. All attendees are in listen-only mode.
Hello, good afternoon, and thank you for attending today's webinar on using logic models for planning and evaluation. I am Elton Oswood, Senior Program Analyst at the Office of Minority Health Resource Center, co-presenting with Ms. Tamara Henry, Senior Program Analyst as well at the Office of Minority Health Resource Center. Next slide. The objective for today's webinars are to introduce you to SMART goals and logic modeling, describe how to develop a logic model, and then finally to illustrate the application of logic models in planning and evaluation. These are the three objectives we hope that participants attending this webinar will be able to get from our presentation today. I'm going to go ahead and have Dr. Tamara Henry go ahead and present a portion of SMART objectives at this time.
Next slide. Before we get started, it's important to understand what an intervention is and why we need to use these in public health. An intervention is an action taken to improve a given situation or context. It also considers the socio-ecological framework. Next slide. The socio-ecological framework provides a number of methods in which you can intervene in a particular health issue. So for some, based on your organization, you work on a one-to-one basis and you prefer to interact at the individual level, which would address primarily change in knowledge, attitudes, and skills. For other organizations, you prefer to intervene at an interpersonal level where family, friends, and social networks would be included in your intervention. In an organizational intervention, one would address the organizations and or social institutions where your target population resides. In communities, it's very broad. It can include churches, sororities, fraternities, memberships, so different organizations where you'd prefer to have your intervention. At the public policy level, we look to change laws, change policies, and ideally legislation through creating better infrastructures on the ground in our respective communities. Next slide. To begin this, we should all be very familiar with SMART objectives. SMART objectives specifically stand for specific. You want to make sure that your goals and objectives are specific and it pertains to your population. Measurable, it needs to be measurable. What are the indicators that you are measuring? The A represents achievable. How achievable and or attainable is this goal you're alluding to? R stands for a number of different things, but I like realistic. I prefer realistic. Are your goals and objectives realistic? Is this something that can be accomplished in the T for time for your intervention? Can you do this in a way that it's relevant, responsive, realistic, but also timely? Does your time frame fit the needs of your intervention and or project? Next slide, please. So there are a number of ways and methods to achieve these objectives. Objectives can be typically educational, which could refer to an intermediate goal, behavioral, and or health related. They should closely align with your outcomes, and it impacts the logic model as they are more specific. Next slide. So when we talk about aligning objectives, you'll have an overarching goal for any project or intervention that you decide to take on, but they will vary by education, behavioral, or health objectives. 85% of participants in the Heart Health Program will be able to name at least 5 foods low in saturated fats by the 4th week of the program. So in this educational objective, you see that we're looking to address persons at the individual level. We are taking into account the time of a 4-week period, and we're also looking at at least 5 foods low in saturated fat that these individuals will know. Up to 85% of your participants will know. So it's specific, measurable, attainable, realistic, and timely. That's all noted within your educational objective. In your behavioral objective, 50% of participants in the heart health program will reduce daily dietary intake of saturated fats to less than 35% of total caloric intake by the 3rd month of the program. So in the behavioral objective, you'll see that the individuals in your program are actually reducing their daily dietary intake, which speaks specifically to the behavior that we are hoping for them to change within the 3rd month of the program. For the health objective, 35% of participants in the heart health program will reduce blood cholesterol to below 200 milligrams per liter after 2 years of program implementation. So again, we're looking at the overall health of your participants in your project, and we're using the blood cholesterol measurement after the course of 2 years of your program implementation. So all of these objectives speak to the SMART goals and objectives, but also they incorporate each step of that. And further, we're going to talk about how one can use logic models to even streamline this further. Next slide.
Thank you, Dr. Henry, for being able to explain the SMART objectives and how those will be able to be used within the logic model in the process of developing some of the outcomes and for objectives when we're doing that. So we'll come back to some of the objectives later on in the presentation, but we just wanted to give you an overview of the SMART objectives. So now I'm going to be talking about an overview of what a logic model is. Basically, a logic model is a picture of your program, the program that you're anticipating and developing, and what you're putting into the organization, what you are doing, and what you are trying to achieve. So it's the overall understanding of what your program will want to exist to be. It also clarifies the strategy and how you're wanting to implement your program. Really looking at the different pieces you want to kind of put together for your program. And it also builds upon a common understanding, especially about the relationships between actions and results. So what will the actions do and what will the real results do, and how do they kind of lend to each other to establish these understandings is really important. It also communicates what your program is and also what your program is not about. So it helps you as individuals as a part of the program to understand what you are wanting to do with this program, and allows you to communicate in an effective way. It also forms the basis for evaluation. So when you're developing your model, it also gives you an inclination of being able to take pieces and components that will help to establish some evaluation tools as well as some evaluation outcomes. Next slide. So this diagram is for more of our visual learners. I'm a visual learner, so I like to see diagrams on how things are put together. And this is just a basic diagram of what a logic model is. So it starts off on top with the program goal. So what is your overall aim and intended impact? And under that program goal, you have 4 basic components of a logic model. The first component is resources. So the resources consist of the inputs dedicated to or consumed by the program. So what is needed to be able to reach your program goal? So you'll be able to identify some resources. The next box over is activities. The activities are actually the actions that the program takes to achieve the desired outcomes. And if you look at resources and activities and think of them more as the how are you going to reach your program goals? That's kind of an important thing to kind of keep in the back of your mind when you're developing your logic model. And then as you continue, you have outputs. And outputs are the measurable products of the program's activities. So what is going to be produced from the activities that you suggest? And then following the outputs is the outcomes. So what is the benefits, for example, to clients, to the communities, to the systems, or to organizations that you intend to receive overall? So if you look at the two boxes at the end, primarily outputs and outcomes, and think of them more as the why and so what components of your logic model. So hopefully this diagram helps kind of put together the basic structures of a logic model for everyone. Next slide. So there are different looks and additional components to a logic model. We kind of want to go over. Logic models can be graphic, they can be a table, they can be a flowchart, or they can be a narrative. So for instance, I mentioned that I'm very much a visual type of learner in understanding some of these processes. I like the graphic part of it, but some of you may be more inclined to do a table, and some of you may be express or communicate more so in a narrative fashion, and it's okay to use these different types of components in developing your logic model. A logic model can also include information about assumptions, externalities, contextual issues, as well as behavioral theories such as the health belief model, or the social cognitive theory, or the trans-theoretical model. And those are the acronyms listed on the slide. But fundamentally, the logic model is a way to communicate what your program is about, ultimately. Next slide, please. And then this is just an example that we'll utilize throughout the presentation to kind of give an example of the process of a logic model. So this diagram gives an example of a program goal, which is to improve the oral health of low-income children who receive primary care in a community health center. So that is our primary goal for the program. In order to reach that program goal, we'll want to be able to identify first resources, which can also include a dental clinic coordinator, a community health director, staff dentist, staff pediatrician, medical providers, as well as money for supplies. We'll always need money, most times. And then activities. Activities gained from your resources can include trainings by developing an example is by developing a curriculum in terms of 2 one-hour didactics for medical providers in oral health assessments, one-on-one training to medical providers on oral health. Those are all trainings, and you might want to consider doing some outreach. So outreach can include order dental supplies for packets, make up packets, and distribute to parents at the end of each visit. It can be an outreach activity. Now what you're going to gain from the activity is the outputs. So from the trainings, the number of 2-hour trainings that you're holding, the number of one-on-one trainings that you held as well, and the number of medical providers who trained. So you're gaining those from the training activities. And then the outreach, some of the outreach outputs can include number of parents and children receiving the packets. And overall, the outcomes. What are going to be the overall outcomes from your program goal? In this example, medical providers demonstrate accurate oral health assessment, education, and prevention activities. Another example is more children receive high-quality oral health assessments and education and prevention activities. as well as parents and children are more knowledgeable about oral health and caring for children's teeth. And then ultimately it would reduce incidence of cares in children at the community health center. So this is an overall example of how a logic model can be created. So it's very concise, but also very general, because hopefully by the time you establish your logic model, you can get more specific. Next slide, please. Again, with my continued visual learning, we have the boxes here about the 4 different components of the logic model, but then something we like to call a series of, quote, if-then statements can be used, and that'll help you as someone who's developing your logic model kind of figure out what parts are needed or what may not be needed. So under the resources, we have certain resources are needed to run your program, obviously, as we mentioned before. The activities, here we go now, if you have access to them, then you can accomplish your activities. So there's an if-and statement there. And outputs. If you can accomplish these activities, then you will have delivered the services you planned. And then finally, with the outcomes, if you have delivered the services as planned, then there will be benefits for clients, communities, systems, or organizations. So by being able to utilize these if-then statements, it is a resourceful tool to see how you are able to define your logic model. Next slide, please. We have the little cute arrows there that kind of tell you how each processes go from left to right. So just to wrap up this kind of umbrella understanding of logic models, there are 3 components of a logic model. You have your inputs, which consist of your resources, which can include human resources, partnerships, equipment, supplies, materials, and community resources, as well as outputs, which are your activities. So products, services, infrastructure of your organization, those are all considered output activities. And then finally, outcomes, results, or effects. So there can be short-term outcomes, mid-term outcomes, and long-term outcomes. So we'll get more a little specific on some of the outcome activities within this presentation, which are the results and effects. So at this time, I'm going to turn it back to my colleague, Ms. Tamara Henry, to continue talking about implementing in the process for a logic model.
Next slide. So for the organizational goal, you want to think about what is your overall aim or intended impact. Organization to organization, that will differ, but we have 2 examples here, one of which we will use for the remainder of this webinar. So the first is to improve access to health care for 100 people with limited English proficiency in Northwest Washington, D.C. in 6 months. So as you can see, it's written in a smart way. The next reads, to improve oral health by reducing the incidence of cavities in 100 children, ages 5 to 10, over the course of 12 months who frequent a Washington, D.C. community health center. Next slide. So as Elton just indicated, the inputs that are associated with resources can range from human resources to facilities to equipment to partners in technology. When you are applying for any sort of funding, these are things that you need to think about immediately. What are the things that you have that will make your program or intervention flow seamlessly? What are the things you don't have? For things that you don't have, you may want to consider writing a proposal for that. But the first thing you want to assess is, do we have the resources to implement this particular program? Next slide. what is the program doing by way of activities? So think about the components. Are you all providing outreach? Are you training physicians or educators or community health workers? Are you offering consultation services? Do you want to implement staff development, continuing medical education or nursing education? Or do you want to just develop further partnerships, further collaboratives in your particular target area? Next slide, please. For your activities, you want to really narrow the components as much as possible and expand the details for the reader so they'll be clear on what it is that you are trying to achieve. So for your outreach, some people you want to develop and distribute flyers. This may be one of your short-term outcomes or short-term goals in the process. Meet with community stakeholders, schools, or parents. Perhaps you want to conduct a focus group with your target population, develop press packets, identify media contacts, send out press packets. Those are some outreach activities that are pretty specific, and once you define the time frame in which you'd like to do these, you then will determine if you want that to be a short-term outcome, an intermediate outcome, or a long-term outcome. And all of these are pretty much between short and intermediate for the outreach. For your training portion in your activities component, you want to decide, are you going to hire a curriculum development team, which is costly? Do you want to develop the training curricula yourself, and what would that entail? Do you have the staff to do that already? That would have been addressed in your resources. Do you want to recruit the training team, recruit participants, or perhaps even provide the training session yourself? Next. So back to the logic model example. We've left a couple of things blank so you can start to think about how you would probably expect to see these outputs, or what you would expect as a result of these resources and activities. So the overarching program goal for this particular example is written in a smart way, and it's specifically to improve the oral health by cavity reduction of 100 children ages 5 to 10 years old over a 12-month period who receive primary care in a community health center. So as you see, we have, in terms of resources, we have the dental clinic coordinator, the community health director, staff dentist, pediatrician, a number of medical providers, as well as money for supplies. In the training, the activities that we wish to implement include developing a curriculum, one-on-one training to medical providers on oral health, as well as 2 one-hour didactic trainings to medical providers in oral health assessment. In terms of the outreach portion of the activities, we want to order dental supplies and make up packets, as well as distribute these packets to parents at the end of each visit. Next slide, please. So what is your program producing? What are the items that you will be able to tell the funder that as a result of implementing these resources and activities, we expect to see X? So this is measurable, and as you can see, the number of training workshops held, number of participants attending each workshop, the number of partnerships formed, perhaps the number of policy briefings conducted if it's related to your program, and the number of press packets disseminated. Next slide, please. So again, we have these outputs. We have a number of 2-hour trainings held, as well as one-on-one trainings held, and those trainings could be held for medical providers, oral care providers, dentists, dental hygienists, as well as parents. What should the parents look for? And we want to make sure that the parents know and are intimately involved with the providers in terms of not just getting the packet, but knowing what is in this packet and making certain that they understand the importance of bringing their child to the dentist regularly. So what are some of the outcomes that we should expect as a result of these resources, activities, and outputs? Next slide, please. So, for example, one, you see the resources. What difference is the program making? We should always be thinking about that because the outcomes are about change. Are we increasing skills, increasing knowledge? Are we changing attitudes, perhaps around dental screening? Are we modifying behaviors or practices, maybe encouraging children to floss more? Are we changing conditions? Next slide. So some of the outcomes that one may expect, given this is over a 12-month period, could be that medical providers demonstrate accurate oral health assessment, education, and prevention activities. More children receive high-quality oral health assessment, education, and prevention activities. Parents and or children are more knowledgeable about oral health and caring for their teeth, not only children, but also the parents. And ideally, we hope to see reduced incidence of caries or cavities in children at the community health center as a whole. Next slide, please. So the chain of outcomes are as follows. The short term are the most direct results of the activities and outputs generally achievable in 1 year. The intermediate links the program's short-term outcomes to its long-term outcomes. So if we want to see children have less cavities over the course of time, we would hope that there were a number of things they were doing in between, which could be addressed in your intermediate. This data could be collected via the children's visit with their parents or via questionnaires. Are you flossing more often? And hopefully, if the children are flossing on a regular basis, we would hope that we would see different long-term outcomes, as well as the provider knowledge. Are they discussing cavities and or brushing with each and every patient? That could also be an intermediate goal that we would look for, or an intermediate outcome that we would look for. The long term is a result from the achievement of short and intermediate term outcomes, and often take a longer time to achieve. So if one visits the dentist annually, we would hope that over time, if you go the first year, we may have caught cavities then, the second year, less cavities, and the third year, perhaps no cavities, and that would be the long-term result that we are trying to achieve. Next slide. So here you'll find the written version of what I just said. So for some of the short-term outcomes, medical providers demonstrate accurate oral health assessments. Parents and children are more knowledgeable about caring for one's teeth. So that's short-term. Ideally, we could see that in about 3 to 6 months, depending on how often the program occurs or how often you question the participants. The intermediate outcomes, we're hoping that more children will receive high-quality oral health assessment and prevention activities during well-child visits. And for the long term, as stated previously, we would expect a reduced incidence of cavities in children receiving care from the community health center. Next slide, please.
So thank you for explaining that process of a logic model in terms of how the different inputs and outputs and the resources as well as outcomes are structured for our specific example about dental care for children. On the site here, we wanted to make available some logic model resources for everyone. There's an online course on developing logic models and evaluation plans, which is offered by the University of Wisconsin Extension and designed for the beginner. There is a website there that we have for them that people can access. The W.K. Kellogg Foundation also has a logic model development guide. It's clear and concise with discussions of the use of the logic models. And there's a PDF version that you can download from their website. Other logic model tools include a comprehensive list provided by the CDC, There again is another resource that people can access off the CDC website. Innovative Networks Workstation. This is an online workstation with evaluation and planning tools designed specifically for nonprofit organizations. And you can access that at the website there. And then finally, we offer a resource for Community Toolbox. And that is listed there in terms of some examples from their website. Next slide. Oh, so we are at the end of our presentation, and we have our moderator who is assisting us, Ms. Maria, who will be able to take any questions. Maria, do you want to go through that process for them on how questions will be taken?
I certainly can. They're doing a good job thus far. What you guys need to do is there should be a questions box in your panel in front of you, and just type the question there. And to all of you asking about the PowerPoints and if the presentation will be available, yes, if you look at your panel where it says handouts, a PDF version should be right there for you to upload. Do we have any questions? Okay, we have a question here. Do you have any suggestions for finding common indicators that can be used to help measure outcomes?
I think it's really contingent upon the project. So if you give me some more information about what it is exactly you're trying to incorporate, I can probably direct you to that.
Okay, one moment, please. The questions are coming in hard and fast.
Okay. Indicator.
We have someone here who wants to know how you can deal with this assessments and how you can put suggestions in place when you are a one-person staff.
That's $1 million question. When you are a one-person staff, I have to say that partnerships are really the key. If you are solo, you're a sole proprietor, this logic model and being able to write things in a smart method will really help you to tease out all of what you can do as the expert in your subject matter, and really to determine what are the resources you will need to move forward to make your project a success. I would not take all of this upon myself as a sole proprietor. It is extremely important for you to know others in the field that you may draw on for that expertise. I think that that's the best way to work, especially if we're talking about public health. It's better to work in a collaborative manner.
Should there be activities that measure the outcomes you describe, for example, testing parent knowledge?
The question is, should there be?
Yes.
Okay. I think that, again, it really depends on what it is you're trying to do. I think that depending on your audience, your target audience can vary. So if we hope for children to perform a particular behavior, I do think that it's important to address the parents. If we're talking about children that are ages 5 to 10, and we're using the social cognitive theory, which is, behavioral determinism, vicarious learning, you are looking at your parents. So that's the person that you learn the most from. So yes, I think that it is important to assess at what level the parents are in terms of oral health or reading comprehension or whatever the issue is, so that you'll know what you're working with, and perhaps you'll need other resources and or activities to measure parent knowledge. If the parent's knowledge is low, or if it's too high, maybe you don't need certain things.
All right, our next question is, how frequently do logic models change in a given in a given organization? Should they get updated over time to consider new factors and variables regarding an intervention?
Absolutely. Absolutely. What you'll find is within your first 6 to 9 months, sometimes earlier, you'll see that things aren't working according to plan, either in recruitment numbers, either in surveys being completed, and perhaps everything went really well 1 year and you were able to provide a process evaluation to your funders. But if you have a resource drain in terms of a high turnover, or you've run out of grant money and you're waiting for the next pot of money to follow through, you absolutely can change it, because it will help you think better and it will help you foreshadow things that will come that may change your outputs and your outcomes as a result of a resource change. So logic models should definitely be regularly updated to account for your external factors.
All right, so we have 2 questions here that deal with involving partners and community stakeholders as you build up your logic model.
Okay, I'm sorry, I did not follow that. Can you repeat that?
Oh, sorry. So let me read the question as it was.
Okay.
Here. Should you have a logic model meeting with partners and stakeholders as you develop your logic model work plan?
I think yes, definitely. Elton?
Yes, I think it's very important to involve your stakeholders and your community leaders who you've identified to be a part of this process. The logic model process should be inclusive of people who are going to implement this, whether they're individuals you identified through your resources, if it's going to be staff that's going to be actually implementing the activities, outreach workers, volunteers. It's always a great idea to involve individuals who will help to implement this logic model. Most times they will give information that you may not have even thought of, or if it needs to be updated, they'll be able to make those apparent to you as well. But your community partners, your partnerships, your collaborations are very key for some programs that are needing to implement large projects, more specific projects. So I would definitely include them in the process.
All right, the last question we've received is, what is the experience in using logic models internationally?
What's the experience in using? I haven't used them as much internationally, maybe just 1 or 2 programs, but really it's about the resources, the activities, the short and long-term outcomes. So what you'll find in obviously a lot of developing countries is that they are under-resourced in terms of having the infrastructure to implement a lot of projects. But what they are not under-resourced in is community health workers and persons who may not be formally trained, educated, but really, really committed to their community. So I think that when you have those kind of resources, you are able to expand a logic model accordingly by looking for those measurable activities and really thinking realistically about the outcomes that you wish to see going forward. Because remember, this is just providing you a framework for how things should look, ideally, hence the reason it's a logic model, right? This is how things should look with all things considered. This is what it should look like. However, if we change the conditions or we change the geographic locale, yes, to see some things change, but I don't think that it's for the worse. I think that people in developing countries we can actually learn a lot from, because they are under-resourced and underutilized, and they find ways to make programs work and eventually become evidence-based. So I do think that logic models still are very important in those international settings.
All right, thank you very much. Do we have any further questions at this time? All right, well, thank you very much for everyone out there for joining us today. And now back to Elton and Tamara.
Okay, Maria, can you go ahead to the next slide, please? I think the next 2 slides.
Next two.
So this is our contact information here at the Alvis Minority Health Resource Center for individuals who may want to follow up with more questions or may need additional information to this presentation. You can reach us there at the telephone numbers as well as our website and email address. Next slide, please. Just wanted to make everyone aware of an upcoming webinar which will be held on Monday, October 17th. Again, from 2 p.m. to 3 p.m. Eastern Time on the topic of getting to know the federal government and funding opportunities. I think this will be a little bit more exciting webinar for everyone, and it will provide best practices as identified by previous federal funder panels at previous workshops to reveal how to respond successfully to federal funding announcements. So opportunities for federal fundings are also hopefully will be identified as well and presented at this webinar. So just wanted to give everyone an opportunity to know about this webinar. We'd like to thank everyone for being on this webinar. I believe we're going to end a little early. Hopefully everybody was excited about logic models as we were in presenting them. And hopefully it gives a little bit more information for people who are wanting to solidify some of the programs that they are doing at this time. So thank you again, and have a great day.
Thank you.